This week, another in the series known as Breakfast with Bailey, in which randomly selected teammates sit down with our president and CEO, discuss their experiences and their concerns, ask questions of her, and have their own questions answered. At this past Tuesday's breakfast, Ms. Bailey focused primarily on Blue Ridge's 4 cornerstone priorities for 2015: teammate and provider engagement, physical health, inpatient-outpatient transitioning, and of course, patient-centered care, which this year will focus on the patient experience.
We have got to make sure that our patients are treated with respect, with dignity, and with professionalism when they come here. And our patient experience scores over the last couple years have not been the greatest. We are putting together teams for each of the HCAHPS dimensions. And each of those teams will be working on 1 or 2 tactics that we can put in place this year to help move the needle on how the patient perceives us. And there are things like communication with nurses, communication with doctors, the team worked well together, the environment of the hospital. My medications were explained to me, the discharge process was explained. So it's all of the things like that that tell us how the patient perceived their visit to us.
As she has done in the past, Ms. Bailey questioned the participants about what they like about Blue Ridge and what they feel can be improved. The teammates engaged with her on a wide variety of issues. For example, this exchange between Ms. Bailey and medical laboratory technician Ashley Ward about misinformation surrounding the status of the Valdez Emergency Department.
I'm just curious as still to why some people think that Valdez ER is closed. I cannot figure it out. That's the first thing I check. We had an incident where my fiance's daughter had come home sick and she was wheezing. She's childhood asthma. And the first thing I did, because I know the lab numbers, I called here. I said, how busy is the ER? Because it's closer. Mm-hmm. And she said, oh, it's packed. What do I immediately do? Call Valdez. Oh, there's a 5-minute wait. Come on. And it's like, if it's an outpatient thing, why not go there immediately? Because a lot of times their wait times are less. I don't understand why people are still confused. I mean, we did huge press things and everything possible to say, we're still open. Come here. And it's confusing that. And like my family, I got a letter in the mail. I'm like, did you read the letter? Something about Valdez, something about something. But did you see that the ER is still open?
Breakfast with Bailey is another in a series of events to build open, honest, two-way communication between the Blue Ridge administration and teammates.
So thank you all for the level of commitment that you show to our patients. They come to us, they are hurting, they're scared, their anxiety levels are high, they're in a place they're not comfortable with, we talk in a language they don't understand, it smells funny, and we do things to them that they don't like. And sometimes we give them news they don't like. But we've got to remember to keep the human part of taking care of the patient, and that's to relieve that anxiety and let them know that we truly care.